My name is Anne French. I work for the Catholic Institute of Education. I'm the HIV/AIDS and Gender Coordinator. Our target population is the teachers in Catholic schools primarily, but we also work with learners in Catholic schools through doing demonstration lessons in HIV and AIDS, child abuse, sexuality, pregnancy, teenage pregnancy. I design the workshops and lessons, and then I go with my colleagues where we deliver these workshops and lessons and demonstration lessons, and then we reflect on what we've done and what we've achieved, and we try to improve what I've done in terms of the context of where we're working. It changes from place to place and the audience with who we are working. Our intervention began in the year 2000, and we began with delivering resources for teachers and training them to teach life skills. At this time, there were no teachers teaching life skills, and very shortly after we began, teachers started telling us how pleased they were with what we were doing, because they said the children had become very open and telling them things about their own lives that they hadn't told before. So we found this very satisfying. The project did a baseline, and during the baseline, one of the questions was, who would children report abuse to? And the children, nobody mentioned the teachers. We did a end of project evaluation after 5 years, and by that time children were saying that they would report child abuse to their teachers, which to us indicated that children had become much more comfortable with their teachers, and we felt the life skills teaching had achieved a lot in this situation. When we began this HIV/AIDS and gender prevention project, some of the concerns teachers had were to do with teaching life skills. They were unsure what to teach, how to teach it, even when to teach it, and so we helped them through the resources we had to do this teaching. Certainly after the training, teachers became a lot more comfortable with teaching life skills. However, in the second phase of our project, which began in the year 2006, teachers were clearly unhappy with teaching sexuality education. This has become our focus of the project, is to try to enable teachers to become a lot more comfortable in this area. Learners have at different ages, they have had different concerns. With the younger children, they have found the life skills lessons very exciting. Older children have many questions they need to ask about sex education and about sex. And many have concerns about their own bodies, the way their bodies function. There seems to be an area of unknowing, and this is where our concern is that these youth need to find out, need to know where they can go to ask questions, and it is these questions that are not being answered, and that is a concern for us. When we began this project in 2000, we found that teachers were not teaching life skills. We began working in the Catholic schools, and we targeted about 200 Catholic schools. By the end of that first phase of the project, we found that in almost every school where we'd done training, teachers were now teaching life skills. They're different expertise, and some of the lessons are very bad. And we took at the beginning, as long as teachers were actually teaching, they could be achieving something. But as we've gone on with the project, we realized that there has to be a level of competence in these lessons for them to have any effect. And so we've been encouraging teachers to use interactive methodology, to let go of what we see as old-fashioned teaching methodology, which uses the lecture method. And hopefully by the end of this project we will have achieved that. We are seeing some changes, however. We were given a wonderful resource called Auntie Stella, and the Auntie Stella resource encourages teachers to use interactive methodology to get the learners to discuss and ask questions, make decisions for themselves. And this material itself is causing teachers to change the way they teach. Changes in learners, teachers told us after they'd been teaching life skills for some time that learners were becoming more open, that they were talking out, that they were speaking about their problems, that they were talking about child abuse. As a result, there have been cases of child abuse that teachers have recognized and have now reported to the correct authorities. So we are pleased in this change that is taking place in learners. This project certainly has had an impact on my life. I think as a white South African, it's been a great privilege for me to work with my colleagues from different regions. And it's also been a privilege to work in many of these schools and to feel the acceptance that I get from when I do visit the schools in rural areas. Particularly what has been significant for me was this year we started doing sex education lessons with learners. And here I am, a white middle-aged woman, and these learners who are black learners have responded in ways I would never have imagined, and have asked questions and continued asking questions until we have had to say we have to bring this lesson to an end now. And that for me has been really wonderful. I would like to share a story with you, something that I found very heartwarming and very heartbreaking at the same time. A colleague and I visited Kokstad and the Kokstad schools, Catholic schools in the Kokstad area, in March of this year. Our role there was to introduce a health screening project to teachers, but also to do lesson observations in life skills. On the last day that we were to be in Kokstad, we visited a farm school called Tefeni Farm School, which lies between Kokstad and on the way to Underberg. It's in a beautiful area with rolling hills and typical of KwaZulu-Natal, Drakensberg type area. The school itself is situated in a dilapidated church, unused church. Opposite is a beautiful lake with ducks and geese, and in the distance are the farms with produce covered. And so we went into the school not really expecting a lot to be happening at the school, because we knew that there were very few learners. It was a Friday, often on a Friday, the schools simply close early and everybody goes away. When we arrived at the school, we were greeted with great enthusiasm by the teachers there, and one teacher introduced herself as having been a pupil at this very school, and as having come back to this school as a teacher to give the learners hope that they too could rise above being farm school children. We did a lesson observation, but afterwards we sat down to introduce the health screening project to the teachers. Soon the environment became extremely noisy because the children, there was no one to look after them. So I went and I took flip chart paper and Koki pens, and I encouraged the children to draw, which they did. The room smelled bad. There was a child there, the teachers pointed out, who defecated and urinated on the floor. There were other children who were unwashed. These children are labourers' children, very, very poor, the poorest that you can get in South Africa. And one of the children, the teacher pointed out to us, couldn't speak at all, and she was 14 years old. later on, as we'd finished what we were doing and we were collecting our things to leave, the teacher pointed out a young girl, very thin, poorly dressed child, and she said this child had been raped by her uncle continuously from when she was young. When she came to the school, the teachers began to recognize the signs of sexual abuse, and they followed up. They didn't leave it. They phoned the police in Kokstad. The police came, the uncle was arrested, and the situation was dealt with. However, the child still lives on the farm, and I wasn't sure who was taking care of her from then on. But it was, for us, a deep understanding of the difficulties people face in these very, very poor environments, and what a magnificent job these teachers were doing at that school.